On a daily basis, we come across millions of families who live in the United States and work very hard in order to keep afloat, to remain employed, and to keep their families and livelihood financially stable. Many of those families are uninsured, and an illness can affect the family economy drastically and turn their future uncertain and tremendously frightening. This is the story of one of those working families, the Vasquez family, a poor, happy, united, and loving family. They work very hard to make ends meet. One day, mother and daughter Maria go out for a stroll, and as they pass the window of a shoe store, Maria, who's 6 years old, notices a pair of little shoes that she really likes. Maria says, "Mom, those are the shoes I need for school. I really like them." Mama knows that Maria needs those shoes. However, they're expensive and she may not have enough money to buy them. Mother doesn't really want to disappoint Maria, so they both go into the store very happy. Maria tries her shoes, and she just imagines what it will feel like bringing those shoes to school. It is time to pay. When mother checks her purse and counts dollar per dollar and penny per penny, she finds out that she doesn't have enough money. Mother can't help. She feels devastated. She feels so sorry and heartbroken for Maria. Maria then started to cry because the feeling was too strong. Mother and daughter now walk down the street feeling sad. Once mother and daughter board the bus, mother feels so frustrated because she cannot afford to give. Suddenly, mother takes her hands to her tummy and screams in pain. Maria asks, "What's wrong with you, Mommy? Don't worry about the shoes. It's not important. I just want you to be well. Really, I don't want the shoes." Mother tries to assure Maria that now she feels well and the pain has gone away. However, as the days go by, the pain is getting worse, more severe, and she has to go to the emergency room. The emergency room doctor tells mother that he needs to do more studies and some blood tests. The doctor tells mother that she's anemic, she has a tumor in her womb. Days later, when the bills come in, just for going to the ER, bill comes back for $3,000. Mother, horribly worried, looks for other alternatives and sees other doctors. They all come to the same conclusion. She can't pay that amount of money, and in addition, she needs to pay the cost of the hospital. The family just cannot afford it. Weeks pass. Tumorzilla, as we will call the uterine tumor, is getting bigger. She's bleeding excessively. Her belly is getting bigger too. Mother has to go back again to the emergency room, and now she needs transfusions. The story repeats itself one more time and another time. Family takes mother to the Hope Hospital. This is a community hospital where a physician assistant refers her to a gynecologist who eventually recommends removing the uterus, a hysterectomy. Mother is finally scheduled for surgery, but she first needs to go to the finance department. So mother is sent to the finance department of the Hope Hospital. And the clerk says, "Give me your insurance card." And mother says, "But I don't have an insurance." "Oh, then you don't qualify," says the rude clerk. "You have to apply to a social program, but this may take months." And mother says, "But I need the surgery because I'm bleeding, I'm getting weaker, and Tumorzilla is getting bigger, and I can't stand the pain anymore." The clerk says, "Well, you can have your surgery next week, but you have to pay the cost, and in order to have the surgery, you have to leave a deposit. If there's no deposit, there's no surgery." Mother says, "Oh, please help me. Please talk to the doctor. Tell him to authorize my surgery. Please tell him that I don't have any money for the deposit." And the rude clerk says, "I already told you, lady, what you need to do. That's not in my job description. Next patient, please." 6 months have passed. Tumorzilla has enlarged to the point that makes her look pregnant. What to do? Where to go? Fortunately, a concerned friend tells her about CSF Foundation and recommends her to call, make an appointment. The CSF Foundation counselors help mom and guide her. The CSF Foundation is the place they need since they don't have insurance. In fact, they're going to help them with the cost of surgery. Finally, mom is seen by a gynecologist surgeon of the CSF Foundation, and she is scheduled immediately for surgery. Soon, mother goes to surgery, and the surgery is a success. The CSF surgeons have removed tumor zilla from her uterus. Today, Mother is very happy recovering with her loving family. She feels so good that she wants to go to work as soon as possible. Mother and Maria, with the medical staff of CSF Foundation, feeling glorious and empowered thanks to the CSF Medical Non-Profit Foundation. A healthy community will only take us to success and economic growth and development, as well as happiness for all the families and all of us as individuals in our community. We should all be part of CSF. CSF, Medical Non-Profit Foundation, for patients without medical insurance. Thank you for your support.